Hi, I'm Sheila Higgins. I'm one of the producers of the documentary Stranger at Home, which is currently in production. Thank you so much for showing interest in our veterans' struggle for better mental health care. Now, in this short video, clinical psychologists Tamsen LaDou and Anna Benson discuss symptoms of PTSD in soldiers.
I think one of the things that I came to know very, very quickly was the fact that these combat veterans didn't have just one trauma event. Sometimes there would be multiple traumas in a day, sometimes multiple traumas, just being away from home, being in very rugged territory, 130-degree temperatures, but also we heard story after story and continue to hear story after story of what didn't happen. Stepping on the ground and hearing a click, knowing that you've stepped on an IED that maybe is a dud or didn't detonate. Or sometimes mortar attacks that you fully expect to kill you and then you don't die. A lot of things that, unexpected twists to different things that happen. So I think that, in addition to the fact that we redeployed these people, or many of them had multiple deployments, multiple traumas, multiple, what we call as therapists, narratives of experiences that happened. And I think most civilians really, they don't understand that.
These people go to their trauma where most trauma happens to them. A trauma happens to, but these young men and women seek out the trauma. And it's interesting too, when they come back and they can't adapt to this culture now, the only place they feel normal is back in combat. And they go back there, they didn't have sleep problems when they were deployed, they didn't have the headaches, they didn't have the anxiety. I mean, they did in a combat kind of way, they were hypervigilant, but it's when they come back that they can't go to Kmart. They can't go to Walmart or wherever the store is. Mm-hmm. They can't stand their children crying. They can't, and that oftentimes happens because they remember the children from the war zone. And it's like Tammy was saying, it's constant when they're there. Every single moment that they're there, there's a threat of their life or their buddy. And there's this camaraderie there that is so strong and so intense. And then they come home, and this is where the support system falls apart. They're the guy they were sitting with in the trench, or that they were protecting each other's back, he's gone now. He either leaves or he's in another unit, and they're left alone in an environment that they can't adapt. And there's a real effort to help, but I don't think anybody understands or has experienced the severity of what goes on. The sleep is, everybody comes back with a sleep disorder. If they don't, you're surprised. It's like an oddity if somebody is getting a good night's sleep.
Won't you please lend us your support by visiting our website and signing up to make a difference?